We acknowledge the land we are meeting on is the traditional territories of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. We acknowledge that Toronto is covered by the Treaty 13 with the Mississaugas of the Credit. Today we welcome Honourable Sylvia Jones, Deputy Premier and Minister of Health, Honourable Peter Bethlenfalvy, Minister of Finance, and Honourable Natalia Kushendova-Bashta, Minister of Long-Term Health. MPP Christine Hogarth, MPP Don Gallagher-Murphy, Zane Colt, Board Chair, Conceivable Dreams, families and community members. Welcome to ReproMed Fertility, a full-service fertility clinic based in West Toronto in practice since 1990, founded by Dr. Alfonso Delvay, who is traveling out of country today and has shared his regrets. The clinic is led by Drs. Delvay, Badurian, and Chong, providing a complete range of fertility assessments and advanced treatments, including IVF, pre-implantation genetic testing, and egg freezing. The clinical team has a long-standing reputation for solving even the most complex fertility challenges, seeing patients from across the GTA, across Ontario, and even worldwide who seek out their expertise. Please join me in welcoming Deputy Premier and Minister of Health, the Honourable Sylvia Jones, to the podium.
Well, thank you, Dr. Nayad, and good afternoon, everyone. Today is indeed an exciting day. It's wonderful to be here in Etobicoke at ReproMed Fertility, alongside Minister Bethlenfalvy, Minister Kushendova-Bashta, MPP Gallagher-Murphy, and of course, your local champion, MPP Christine Hogarth. She has been such a force to reckon with as she advocates in Queen's Park and particularly for fertility issues. So thank you for your advocacy, Christine. I also want to thank the many partners who have joined us today, as well as the entire team here at ReproMed Fertility for everything you do to provide care and support for those wanting to start a family, and for hosting us to announce one more way our government is taking action to connect more families to the care they need closer to home. Under the leadership of Premier Ford, our government is making record investments in healthcare to make it easier and more convenient for families to connect to the care they need at every stage of life. Our plan is called Your Health, and it is focused on taking bold action and making innovative changes to provide more people with the right care in the right place by expanding hospital capacity, launching new primary care teams, and improving access to key services like fertility treatment. Our government recognizes there is no more role more special or important than being a parent. That is why each year, through the Ontario Fertility Program, we provide access to publicly funded fertility services to support thousands of people looking to start or grow their family at 50 clinics across Ontario, like ReproMed Fertility. We also recognize that more can be done to give everyone in Ontario the special chance at parenthood. Today, I am thrilled to announce that our government is investing $150 million to expand the Ontario Fertility Program, tripling the number of families able to receive government-funded in vitro fertilization cycles at more hospitals and community clinics. Our government's investment will ensure tens of thousands of more Ontario families can access fertility services by expanding the programs to include more clinics, giving patients more options where they can access publicly funded fertility services, reducing wait times at community or hospital clinics, and help cover the cost of what can be overwhelmingly expensive. Taking the step to start or grow your family can be a very stressful time, and worrying about when or how your family will access key services on the journey to parenthood should be the least of your concerns. Today's announcement will make it easier and faster than ever before for more families to access key fertility treatments and care closer to home. Supporting more families to access fertility services is one more way our government continues to take action to connect more people to the care they need, where and when they need it. thank you to all the families, advocates, and healthcare partners across Ontario who have made this change possible. Together, we are building a more connected and convenient healthcare system that will provide more people with the right care in the right place for years to come. I'd now like to turn the podium over to Minister Bethlenfalvy to share more about another step our government is taking to break down barriers for those wanting to start a family. Thank you. Stay well.
Well, thank you, Minister Jones, and hello, everyone, and good afternoon. And I'm pleased to be here at ReproMed with you today alongside Minister Jones, speaking to the importance of family and what we are doing to help with the unique challenges many Ontarians face when it comes to their parenthood journey. And let me just start by saying, there's many people behind, all the way behind and behind us right here, who've really been supportive of today's announcement. I want to thank Natalia Kusendova-Bashta, who very early on got into my ear and really pushed hard for this. Don Gallagher-Murphy, you've been a champion, and Christine Hogarth, you're right behind me, and many others in caucus. And let me tell you, the biggest champion of all was the Premier of Ontario, Doug Ford. We're very close to his riding. He loves the great state of Etobicoke, so do I. We're putting some GDP here in Etobicoke today, so a big thanks to all the caucus members and the leadership of the Premier, and of course the Minister of Health. We recognize many families encounter barriers when it comes to accessing fertility programs such as the high costs, long wait lists, and fertility treatments. Our aim is to help alleviate these challenges and ensure that more people can realize their dreams of having children. This is why I'm so proud to announce that beginning next year, our government, as the Minister announced, will invest an additional $150 million over 2 years to expand the Ontario Fertility Program. Notre objectif est de contribuer à atténuer des difficultés et de faire en sorte que davantage de gens puissent réaliser leur rêve de concevoir un enfant. C'est pourquoi je suis fier d'annoncer qu'à partir de l'année prochaine, le gouvernement de l'Ontario investira 150 millions de dollars supplémentaires sur 2 ans pour élargir le programme ontarien de procréation assistée. This substantial investment will enable us to triple the number of individuals eligible for government-funded in vitro fertilization, or IVF cycles. This means not just increased access to treatment, but also the expansion of fertility clinic capacity and a significant reduction of wait lists in hospitals and community settings. To provide further financial support for families undergoing fertility treatment, our government will also be introducing a new tax credit which would take effect in January 2025. This proposed tax credit would cover up to 25% of eligible expenses for Ontario residents, which may include IVF cycles, fertility medications, travel for treatment, and diagnostic testing. This initiative reflects the depth of our government's commitment to reducing financial barriers and making fertility treatments more accessible to families right across Ontario. And as I've often said, we believe strong families help build strong communities. We want to ensure no one in Ontario is left behind when it comes to achieving their dreams of becoming a parent. In the coming days, we will share more information about our plan to make healthcare in Ontario more connected and convenient for everyone. So be on the lookout for the 2024 Fall Economic Statement, which will be released next Wednesday, October 30th, for an update on our government's plan to build Ontario, to keep costs down for people and businesses, to create jobs, to build highways, transit, and other critical infrastructure, and to improve services. Ne manquez pas l'exposé économique de l'automne 2024, qui sera rendu public mercredi prochain, le 30 octobre, pour voir une mise à jour du plan de notre gouvernement pour bâtir l'Ontario, maintenir les coûts bas pour les particuliers et les entreprises, créer des emplois, construire des autoroutes, des transports en commun et d'autres infrastructures essentielles, en plus d'améliorer les services. We are doing this through our fiscally responsible plan that balances the budget. Together, we are building a brighter future for individuals and families right across Ontario. And now it's my distinct honor to ask Christine Hogarth to come over and say a few words. Thank you very much, everyone.
Well, thank you, Minister of Finance, Peter Bethlenfalvy, and Minister Jones. Thank you so much for being here. You know, it is truly an honor to stand before you today as a strong advocate for this issue. You know, 2 days ago, I introduced a private member's bill on this issue, but it wasn't my private member's bill motion. It was all of ours. It was the Women's Caucus of the PC government. You know, we have conversations all the time, and it's such an important issue to all of us. I find as we get a little older, people talk about things we may not have talked about in the past, and it's very important to have these discussions. It's an issue that is near to every woman, and many more women than we know have experienced this issue in their lives. In my own conversations, both with my women colleagues and caucus in our community, these stories come up now and again. For individuals and families across Ontario, the dream of starting or growing a family it's overwhelming, and it's overwhelming due to fertility challenges. But today we are sending a powerful message that help is here. And I'm happy to join in as this important expansion becomes a reality right here in our community of Etobicoke Lakeshore. This expansion is not just a policy change, it's a lifeline for those whose dreams of having children have felt impossible. But most importantly, it reflects our PC government's commitment to supporting families. It shows that we're committed to ensuring that every family has access to resources they need to build their families without facing overwhelming hardship and that additional stress. And I really want to thank Premier Ford, who's been such a strong advocate on this topic. You know, he's worked tirelessly to make this expansion possible, so I just really want to thank our Premier. It's a little emotional today talking about this. You know, MPP Gallagher Murphy, we've had numerous conversations, and of course, MPP Natalia Guzendova, you know, and in 2019, Minister Tangri and myself both wrote letters to Minister Elliott just to acknowledge the brave voices out there to look at this issue. You know, I've had conversation with, and I don't want to name all their names, but Caitlin First, she's had such an influence sharing her journey, and all those individuals and families who have shared their personal stories and advocated for this cause. And for those women out there who maybe had to go to a clinic this morning and take a blood test and be brave and put on that brave face as you went to work this morning, pretending that nothing's wrong, today is for you. Thank you.
Good afternoon. My name is Zane Colt, and I am the current chair of Conceivable Dreams Board of Directors. Conceivable Dreams is a grassroots advocacy organization supporting current and future families. We work to build awareness about fertility and reproductive health issues and empower our patients to address their fertility challenges head-on. It's an honor to be here today with Ministers Jones, Bethlenfalvy, and Kusendova Bashta, as well as MPP Hogarth and Gallagher Murphy for this exciting announcement. With 1 in 6 Ontarians experiencing infertility, it is clearly not only a women's health issue, but one that impacts everyone, and my family is no exception. My wife and I have known for years that we would need to use assisted human reproduction to build our family. In 2021, my wife Baden underwent her first round of IVF, and last year we welcomed our beautiful daughter Scotty via gestational surrogacy. As our journey continues to complete our family, we're actually in the midst of our second round of IVF right now. Despite funding from the Ontario Fertility Program, we are nevertheless out of pocket tens of thousands of dollars as we attempt to build our family. The current OFP has made significant strides in supporting families struggling with fertility, but it is limited in its coverage and leaves many with a significant financial burden, making fertility care inaccessible. In addition, the program only includes select fertility clinics, leaving patients on long wait lists to access their funded IVF cycle. In our case, we waited on a first-come, first-served list for 3 years, only to be told that they were switching to a lottery model and that moving forward, names would be drawn from a hat. That's why we're so grateful that the government has listened to our concerns and is here today to announce that they'll be tripling the size of the Ontario Fertility Program while implementing a new tax credit for patients. As the clinicians behind me in the room will tell you, no two fertility journeys look alike. In my family's case, it's not about the quantity of the embryos created, but the quality. Biopsying and testing embryos, as well as screening for genetic preconditions, costs a lot of money, and this tax credit allows for flexibility. It could be used to help my family cover testing and help another family cover fertility medications that are not included in many employer benefit plans. For some, it could be used to travel from rural and remote communities to clinics in Southern Ontario. It could also be even applied to egg freezing so that women can get ahead of future fertility challenges. In short, a tax credit is the right solution because it covers a wide variety of treatments, tests, and medications, providing support to Ontarians regardless of what services they need. These and new investments will help improve access to treatment, reduce financial strain on families, promote women's health, support economic growth, making Ontario a leader in fertility once again. To the ministers and to the Government of Ontario, I want to thank you for listening to patients and for making these important investments. They will make a world of a difference for families like mine. Thank you very much.
Thank you, Minister Jones and Minister Bethlenfalvy, for the very welcome announcement, and MPP Hogarth and Zane Colt for your meaningful remarks. The reproductive medicine field advances continually, and fertility clinic teams have valued knowledge and technology to achieve more successful patient outcomes. On behalf of fertility clinical teams who have dedicated their careers to serving Ontarians facing challenges with conceiving, I'd like to share how deeply we appreciate the Government of Ontario's investment in expanding access to publicly funded treatment. To close, I'd like to welcome back Minister Jones to the podium for media questions.
All right, we'll now move to questions from the media. If media present could kindly do their best to form a line behind me at the microphone. As a friendly reminder, the format is one question and one follow-up. Please state your name and your outlet before your question.
Hi, I'm Andréane Williams with CBC French and CBC English today. My question is for Minister Jones. It's about the delays in supply for home care. So you've called what's been happening in home care unacceptable, but we're talking about patients, some of them palliative, not receiving critical medical supplies. It's gone on for weeks. So will anyone be facing any consequences? And if so, what will happen to them?
So I have said, and I will say again, it is completely unacceptable. We cannot have individuals who are recovering, who are accessing our home care services to have any limitations or delays on their medical equipment and drugs and supplies. Today, right now, we have been very focused working with and directing Ontario Health at Home to make sure that patients who have been impacted by these delivery challenges get resolved quickly. In the weeks to come, we will actually absolutely be assessing where this fell down. You know, we have 5 different vendors across Ontario who have been able to provide the service. There's one in particular that we have seen experience challenges, and we will drill down very carefully. We have now Ontario Health individuals in this facility to make sure that the distribution happens seamlessly. But again, I will say it's unacceptable, which is why we have acted so quickly, ensuring that, for example, individuals, patients, families, caregivers who have gone out and purchased those necessary supplies have a process to be reimbursed quickly.
But you're talking about looking into what happened, but my question also mentioned, will there be consequences, and what will they be?
Today it's about the patients. In the weeks ahead, we will absolutely look at the process where it fell down, and yes, there will be actions taken to ensure that this cannot happen again.
Next question.
Afternoon, Minister. Hello. I'm Tony. I'm here for City News. This is about the Heart Hub treatment centers. The application deadline for the new Heart Hub treatment centers was last week. Do you have updated numbers for the number of applications received?
Yes, we have had a lot of interest from our municipal partners, and what I'm really excited about is as the applications have started to come in and we are assessing them, we're seeing a lot of leveraging of existing, whether it's health, whether it's treatment, whether it's supportive housing. You know, I was very clear in August that as our government brought forward this investment of the treatment hubs, $376 million, we wanted organizations to work together. We wanted those on-the-ground organizations that have primarily focused on healthcare, primarily focused on mental health and addictions or supportive housing come together and submit proposals. And we have almost a 50 applications that we will be assessing and reviewing in the coming weeks.
Within that, will those organizations and locations that have had operated supervised consumption sites, will they be given any preferential treatment?
So they have been told that they have the opportunity to apply and transition a consumption site into a treatment and wellness hub. So yes, those applications will be pulled separately. But again, I will say there is very clear parameters in terms of we do not want to see applications, and we will not be entertaining applications that allow and continue to allow open drug use.
I got one for the finance minister, actually.
Sir, just this here. One, sorry.
Okay. All right, Minister, again, hi, Tony here from City News. It's related to the rebate checks. We're giving out these rebate checks, and the question is, how can we do that while running a deficit?
Well, first off, that's speculation, and of course, I'll have an update in the fall economic statement next week, Wednesday, October 30th. One thing that our government has been very focused on for a number of years is on the cost of living and helping people where we can. In fact, just here in Etobicoke, a couple of years ago, July of 2022, the Premier and I announced the first tax cut for gas. Providing relief at the pumps. Of course, we've continued to do multiple things since then. We've increased the minimum wage, taken off the fees on driver's license stickers, taken tolls off the 418, 412, indexed to inflation for the first time ever, payments for seniors and for people on disability. So, that's something that we're constantly focused on. With regard to balancing the books, I have a clear path to balance the books. In fact, our public accounts, our books were closed for this year. We had a $600 million deficit. We had the lowest debt to GDP in over a decade, the lowest interest expense to revenue since the 1980s. These are measures of fiscal health. And when you compare us to other jurisdictions like the federal government or BC or Quebec, we're the only one with a path to balance. And so we're very committed. The Premier, the government, all of us are very committed to maintaining that path to balance, because to have economic health, to be able to fund some of the measures like this great announcement today, you have to have strong fiscal health, and that's what we have.
Thank you.
All right. Thank you, everyone.
Thank you.
That concludes our media availability. If I could get the podium party to stay up there for a few photos, that would be fantastic. Thank you very much.